Assalamu alaikum students, welcome back to Therapy Kingdom. Today we are going to explore congenital insensitivity to pain, CIPA. So without any further delay, let's start the video. Congenital insensitivity to pain, also known as the congenital analgesia, which is one or more extraordinarily rare conditions in which a person cannot feel physical pain. Do people with CIPA look different? In addition to the characteristic features, there are other signs and symptoms of CIPA. Many affected individuals have thick, leathery skin on the palms of their hands, or misshapen fingernails or toenails. They can also have patches on their scalp where hair does not grow. Hypotrichosis. What organ does CIPA affect? Congenital insensitivity to pain and enderosis is a rare genetic disorder affecting the autonomic nervous system, and it is described as hereditary, sensory, and autonomic neuropathy type 4. It is characterized by the inability to perceive pain and temperatures, sensation, and the ability to sweat. What are some symptoms of CIPA? CIPA is characterized by insensitivity to pain, enderosis, the inability to sweat, and intellectual disability, and this condition causes repetitive injuries including oral self-mutilation, biting of fingertips, bruising, scratching, and infection of the skin. Can CIPA patients cry? Children learn not to touch something hot the first time they get burned. They cry when they scrape their knees, but a child with congenital insensitivity to pain is different. Many parents discover their child has an insensitivity to pain when an accident happens. That should make the child cry but does not. What are the characteristics of CIPA? It's characterized by the inability to feel physical pain and the inability to sweat from birth. Can CIPA go away? Sadly, there is no treatment for CIPA. What are the complications of CIPA? CIPA cases have been known to have tactile hyperesthesia, emphasizing the need for anesthesia. Autonomic nervous system abnormalities causing preoperative complications increase the risk of hypertension, bradycardia, hyperthermia, regurgitation, and aspiration, which should be antisepted. What are the dangers of congenital insensitivity to pain? Patients with congenital insensitivity to pain may have complicating infections of both the soft tissues and skeleton. In addition, the neuroarthropathy and severe infections may necessitate amputation. Infections typically result from a chronic open wound, from an abrasion, burn, or other superficial injury. Can CIPA patients taste food? Since the abilities of CIPA patients to perceive taste and smell were not basically impaired, despite their lower insensitivity to capsaicin, it was suggested that their dietary habits were only minimally affected, except for the intake of pungent foods. What are the reasons for CIPA? Congenital insensitivity to pain with enderosis is a rare condition caused by the mutation of TRKA gene on the IQ21 or 22 chromosome, 38 characterized by the mental retardation, congenital analgesia that leads to the self-mutilation, multiple scars and fractures, and enderosis with repeated bouts of fever. Where is CIPA most common? Although the disease has been reported all over the world, CIPA is currently considered to be rare and sporadic in most population. Israel and Japan have reported dozens of cases, and others have been reported in Korea and Malaysia. So that's it for today's video. Thanks for being the part of the Therapy Kingdom. I'll see you in the next one. Don't forget to comment, share and subscribe for more content.